Today on our second webinar. This is a very, very important subject, a really important procedure that many patients have questions about. It's dental implants, and today we're going to talk all about dental implants. As you might see, we have our amazing smile consultant right here, Marla. How are you doing today, Marla?
Hi, Fer. How are you? God, thank you for being here, and I hope everybody's safe at home. So, and I'm very happy that we are going to talk about implants, and we have an expert. So I'm very excited.
Amazing. And how are you, Dr. Marquez?
We're fine, very good. Right here, trying to explain every question that you have and to help all the patients right now. Any questions?
Amazing. So I'm gonna go ahead and share the presentation that we have for you guys today. I am very sorry I didn't do this before earlier. We're gonna start the presentation so you guys can go ahead and visualize this with us. But first, I'm gonna go ahead and show you the agenda that we have for today. This webinar is scheduled to be approximately 1 hour long, including the questions and answers. Of course, I'm gonna give you the welcome, announcements, reminders, everything you have to know before we start this webinar. And I didn't introduce myself. My name is Fernanda Quintero, and of course, as well as you might know, this webinar has been recorded, and it will be posted on social media a little bit after we finish today. And well, of course, Dr. Marquez, Carlos Marquez, is going to help us to talk all about dental implants, which is our main topic today. And at the end of the webinar, we're going to have our questions and answer session. We will have Dr. Marla to join us today on the question and answer session, and as well with anything that I can help you guys today. Of course, we will be doing that today, okay? So before we start, of course, I would like to introduce formally to Dr. Marquez, that you might see him right now with his uniform and everything because he just got out of a procedure. He is a periodontics and dental implants expert here at Sani Dental Group. He is graduated from Universidad Autónoma de Baja California and has had several continuous studies, not only in Mexico, all around Mexico, but as well in Israel, several courses. We had in Ecuador, Brazil as well. So I'm very sure that you guys will be in amazing hands today. So what do you guys think? Should we get started today?
Let's go.
All right. Well, I will go ahead and turn off my camera and my microphone, so I will leave you in great hands. And well, let's go ahead and talk all about dental implants.
Okay. Well, first of all, let's talk about a little bit about what is a dental implant. Well, a dental implant is a prosthetic part, okay? That the main goal of this is to replace a missing tooth or teeth in this case. How it's gonna do it? This is gonna be attached to a bone and it will replace a missing crown. Next. For what we get dental implants. In this case, well, it's a long-term solution for missing teeth. Like I tell you, it looks like natural teeth. They will replace your missing teeth in this case. And in this case, it will prevent bone loss. Why? Because a dental implant gives us support for the bone. The bone is in constant movement, okay? So in this case, that helps to maintain the bone height in this case. And it gives us a great comfort. Why? Because replacing a missing teeth, well, we can eat again, chew again, and have a very good dental or aesthetic in this case. Next. Okay, we have two types of implants. The dental steel, that is the one that we use right now. That this implant is anchored to the bone by itself. Okay, we have to screw it right there. We have to do a little surgery to attach it to the bone. And back in the day, they used the subperiosteal implant This one it's not attached to the bone, it's just over the bone, but it's inside the gum, okay? This type of implant, we don't use it anymore. We just use the endosteel implant. That one is from titanium, and that's what we're gonna talk right now. Next. Well, with the implants, we have different solutions, okay? One of them, if we have 3 missing teeth or something like that, we can replace 3 of them. Why? Because we anchor 2 implants like for giving us support, and then we can replace the missing pontic in this case. Let's say like the picture, you can see 2 implants on each side, and we're replacing one in the middle. So that's one of the options that the implants can give us. Next. Other option is the all-on-4 implants. This is another different type of implant. It's just another type of technique that we use to replace off our missing teeth. How we do it, we place 4 implants in our mouth, and these implants are anchored to a prosthetic part. This prosthetic part is for people that are missing more than 3 to 4 teeth, that almost have all their teeth lost, okay? And it will help us to rebuild all the missing teeth in this case. Next. Other types are the zygoma implants. This type of implants are for special cases, and they're only for the upper jaw in this case, for the maxilla. Why? Because once we miss all our teeth, like I tell you the first time, the bones start rebuilding and reforming and missing. Why? Because they don't have anything to stimulate. So in the top, there are the teeth. If you don't have any teeth, well, you don't have bone. And if you want a fixed option, the zygoma implants are one of them. They attach to the maxilla, to your face, and they can give you, again, your teeth fixed in this case. Next. Can anyone get dental implants? Well, an ideal candidate for this, you have to get good oral health in this case, healthy gum tissues, free of periodontal disease, adequate bone in your jaw to give us support implants. Avoid taking some medications. Remember, we have patients that take a lot of medications, so we just have to be careful with what we are taking, so you can be a good candidate about this. A lot of persons smoke. That is not a whole contraindication about getting an implant. It's just you have to reduce the amount of smoking. But right after you have an implant in your mouth, you have to be committed about a good oral hygiene, and you have to visit us regularly. Why? Because an implant doesn't react like a normal teeth. Normal teeth can defend by itself because it has blood cells, it has stem cells, it has different types of cells on its way, and it can give back to the bacteria, but an implant, no. So that's why you have to visit us regularly, because we can help you to clean it a little bit more and be sure that everything's okay. That's okay. In this case, which procedure of dental implants we should get? You have to come here first. One of the main reasons is replacing a single tooth. Like I tell you in the back photo, they're replacing several teeth, or in this case, replacing all your teeth. Okay, next. Okay, right after you get here, I will maybe I get in a little bit ahead of the presentation, but once you get here and we know your case, we study everything. You see the CT scan and everything. We have different types of bone regeneration in this case. We have, because of the lack of bone, remember, if you don't have any teeth during past time, the bones start to absorb. So, but we have certain options to give you, again, to give you an implant. In this case, we can do a bone augmentation, sinus lift, that there's a little space that we have inner cavity in their mouth, and or a wrist expansion. This will give us more bone to give your implant in your mouth. Next. What kind of materials are from the implants? Next. In this case, we use two types of implants. The gold standard that we use right now is the titanium implants. It's under all the literature that titanium is very good to compatibility to the bone. Why? We have a lot of prosthetic parts like knee replacement, hip replacement, all of it made from titanium. So in this case, they did the same thing, and now to a little implant so we can attach a teeth right there. The other option is the zirconium material. The zirconium material is a relative new implant. The advantage that it has is a little bit more aesthetic, but it's in this case we prefer the normal titanium implant, but the zirconium material it's a very good option. Next. We manage this top brands like Novel, Stroman, MIS, BHI. So these are the ones that we use right here. Next. Okay, let's get the procedure step by step. First, you can get right here at Sani Dental Group. In your first appointment, you get to diagnosis. You get your CT scan, your X-rays, everything that you need and we need to make a good treatment plan for you. Once we evaluate everything, your bone, your quality of bone, your type of bone, then we decide what is the best option to give it to you. Next. After you decide what we're gonna do, in this case, we have, if you have any problem, we have to do extractions, we have to do bone graft. Why we have to do bone graft every time we place an implant or every time we do an extraction? We have to place a bone graft because, like I told you the first time, the bone is always resorbing and changing. It's part of his philosophy, biology. Sorry. So we have to prevent any type of resorption. That's why we place the bone graft, to help the body to maintain the most quantity of bone right there. Okay. After we place the bone graft, if we cannot place right away the implant, you have to wait at least 3 months so we can place the implant again. Okay. Next. After we do the bone graft and we know that everything is stable, we do the dental implant placement. How are we gonna do? This is small surgery. It can be under IV sedation or local anesthetic. Sometimes when it's a big procedure like an all-in-4 or a Tacoma implant, we decide to go under IV. Why? Because it's a very hard procedure, but it's not that you cannot support it. Once it's a small procedure for a single implant, it takes us around 40 minutes, 30 minutes, and can be under local. Okay, next. Once we have the implant placed, and then you go back to your home, you have to wait at least 4 to 6 months, depending how the case. If we place a bone graft, if we do a sinus lift, if we did a rib expansion, or depending what the treatment that we did. Right after you have the healing period, you have to come back. Okay. Once you come back, you start with the prosthetic part. The prosthetic part, once everything's healed up, they start to attach the abutment. Okay. The abutment is the connection that is going to go between the implant and your crown. Okay. The abutment is custom fit or mill made. Okay. So in this case, you have to wear it. First, they have the doctors. They have to place everything up, do a temporary, make their biting adjustments and everything. After that, we send it to the lab, and then they bring the crown. Okay. Next. After everything's specifically that you like color, shape, size, everything, we start with the crown placement. Okay. We have two types of crown placement. We just anchor the crown, we cement it over the abutment, and then you can just do this. We just do some adjustments and you're good to go. Next. Okay, this was a little bit about the treatments that we have right here in Sani Dental, about all the options. And well, it's a small talk. You know, we can talk hours and hours about every type of procedure that we can do right here. But it's a little hint so you can know that you're in good hands. Right now, if you have any questions about these procedures, about the crowns, about times and everything, you can ask me with any problem. We're here, okay? Hope that it was understandable what I explained, and now I'm hearing your questions, okay?
Yes, you guys, this is the time where you guys have the chance to ask a doctor about the procedure. Remember that there is a questions and answers button right here at the bottom of the webinar page, the Zoom page. So you guys can go ahead and post any questions that you might have. Remember, not only about the procedure, maybe about service. If you have questions about the border, shuttle services, everything will be resolved right here. That's the main advantage of joining a live webinar from Sani Dental Group. Okay, let's go ahead and check this. Give me just one quick second. Okay, we have a procedure. I'm sorry. We have a question from Brian Delman. He's asking, is the procedure done all in dentist chair?
What? I didn't hear it. Sorry.
Oh, is the procedure done all in a dentist chair?
Yes, definitely. We have every dentist that works right here in Sani Dental Group has his own office and his own chair, so you can be comfortable right here. Okay.
Okay. Very important question. How long until you can eat again normal food after the procedure?
Well, this depends what's the procedure. If it's a single implant, you can eat right away. You have to wait if it's an IV sedation, you have to wait around 2 hours right after all the meds that you have in your IV go away. And after that, you can start eating normally 2 hours for an IV sedation. But for normal procedures, you can eat right away. It depends how you feel, okay?
Can I say something?
Yes,
yes, of course.
So I think it's I mean, what Dr. Marquez said, you can right away, but I think it's more like how many months in the process, you know, when they are going to be able to eat after, you know, to use the implant.
Okay, well, right after you have the implant procedure, and after the healing process and everything, you will start eating normally around 4 to 6 months. Why I'm saying normally? Because let's talk about the all-in-4 procedure. That's the more common process right here. Once you have the all-in-4 procedure, you have a temporary prosthetic part, okay? So once you have it, you have to start learning again how to eat. Why? Because you have to eat soft food, medium food. You have to go in that way slowly. Why? Because it's a new thing in your mouth. After that, you will start eating like 4 to 6 months. You will start eating normally, like a steak, something that you can chew hard. For around 4 to 6 months, you can start eating normally with the final dentures. Okay.
Thank you, doctor.
Dr. Marla, your camera is off right now.
Really?
Yes, if you can help us turn it on so everyone can see you.
Okay.
Okay, and we have another question. It says, okay, well, this is a question for Dr. Marla. Do you know when the offices will be completed from being remodeled, and when will the hotel be open for business? is one dental clinic that it's been remodeled, which is Sani Dental Group Platinum. But Sani Dental Group is currently open. I can help you with that right now. And they're working an extended schedule from 7 a.m. to 5 p.m. So you guys will be able to do that. Do you know when the hotel will be open, Dr. Marla?
Right now, I think Cerrito Lindo is open.
Oh, okay. So there is a hotel in Los Algodones for lodging for patients too?
Yes, totally. I mean,
Okay.
right now, we are taking care of all of the patients, but yeah, you're still able to stay in town with us.
Perfect. Okay, we have a question for Dr. Marquez. Dr. Marla, remember, if you want to join us too, you can help us. Can the implant be completed in just one visit? Implant and crown.
In this case, well, we have to evaluate your case first, but it's not recommended to do all at once. Implant, we're talking about one crown, right? Sometimes you can live with a temporary abutment and a temporary crown, but because we have to give the tissue shape and everything. And everything depends how your bone quality, your stability. If everything of that is good, you can live with a temporary crown for 3 to 4 months, and then you have to come back for the final crown. Temporary crown is an attachment, plastic crown that can stay in your mouth for 4 to 6 months, okay? But doing the final crown at the same time, we cannot do that. So it's a little bit difficult.
Okay. We have a personal question from an spectator. It says, I would need best case 8 implants. If that is not workable, can you either do an upper or lower denture?
Yes. Yes, definitely. If you don't have the bone structure or the enough bone to place 8 implants, like I told you in the past in the presentation, we have different types of options. We can do a denture with 2 implants to do a snap-on denture, so you can have a fixed implant, fixed prosthetic in this case. Or we have the options of the all-on-4 that it's a fixed bridge that we can place right there. And well, we have all the options, but like we have to evaluate everything first. Okay.
Yeah.
Okay.
First, but guys, I want to say like Sani Dental has their own patient coordinator center, so you can send us your X-rays, and our diagnostician team can consult Dr. Marquez and they can give you, I mean, every patient coordinator can give you any idea, of your condition or what can be good for you in your case.
Amazing. All right. We have another question. Do you guys place implants on patients with diabetes?
Yes, we can place implants with patients with diabetes. The only thing that you have to be is control. You have to take your meds regularly, and you are like a normal patient. If you take your pills every day, we can treat you like a normal patient. If you are a normal patient, you just have to be controlled.
Okay. It says, can I have an extraction and an implant done in the same visit, or do I have to wait months after the extraction?
Sometimes we can't do it. We have to check your CT scan first to see if we can. Depend how is the extraction. If we have enough bone, like I tell you, if you don't have an infection, active infection right there, once we do the extraction, we check the amount of bone that we have, and we can, if we have enough, we can place it at the same time. But like I told you in the past, we have to do another kind of procedures. Maybe do a sinus lift to the extraction, do a sinus lift, or you can have the implant, or do, in this case, a bone graft, place membrane, and do everything at one stage. Sometimes we can do it, okay? Like 80% of the times.
Okay. It says, if I get an implant with Sani Dental Group, can you assure that is an implant that can be certified in the US?
Of course, all the dental brands that we have right here, they are worldwide, so you will not have any problem with that.
Okay. Is it possible that if you need multiple implants, they will have some done with no problem and some later?
Sometimes, yes, possible. I can tell you, it all depends on the cases. Depends of the bone quality, of the bone stability of the implant, everything. Sometimes, let's talk about a case of 6 implants. We place 6 implants, but 2 they are good, but they don't have enough stability to support the structure. So we work over 4 implants, so you can live with a temporary plate or temporary bridge. Right after you come back, we have the healing time period that the implant is right inside and the body start doing all its process, so he can get more anchored. You come back, we uncover that implants, and then we work with the 6 implants in.
Okay. Can you have the crown to an existing implant placed in the US?
Well, yes.
If a patient has the implant here in Sani Dental Group, can they have the crown in the US? That's what it means. Sorry.
Yes. If you have all the information about your implant brand, you can do that.
All right. Do you need IV sedation to have an implant placed?
It's not necessary. We always recommend when you have a very big procedure like 4 implants, 6 implants, 8 implants. Why? Because that part, it will help you to maintain, relax, and have a good experience with us. If we are talking about 2, 4, 6 implants, but a different size, like something very small, with local anesthetic is fine. You will not have any problem.
Okay, perfect. All right, we have so many questions, doctor. I hope that you are ready to help us. And Marla, I have a question for you from a patient, Sandra. She says, do you accept a care card? Or are there not any other financial options, if you can tell us?
Oh, I mean, we don't work directly with the insurance company, but you can bring your the paper. We can help you with the paperwork. That way you can ask for your money in the United States or your company. But I think it's for $30. We can help you for $30.
Okay.
Sorry.
Very important question that we have right here. Do I have to bring someone with me to take care of me?
It all depends. If you're gonna go under IV sedation, we recommend that because once we finish, you're gonna be a little bit dizzy, sleepy. So it will be a good idea. If you're gonna only have 1 implant, well, you're gonna be able to live right here walking with any problems.
Okay. Now we have a very important question. It says, I see on your website different prices from different implant brands. Does the patient get to choose the implant?
Yes.
Yes.
We give you your options and give you the top brands because every brand has his own specifications, and we give you the top of these cases. But either way, you choose what's the best for you. Okay, we give you the hint and the help to decide, but you have the final answer in this case.
Okay. Is there much of a difference between a BHI implant or a Straumann implant?
Well, the function are the same. Okay, only the brand, if you compare Straumann versus BHI, well, we have a top brand that is Straumann, and it's a little bit of difference. Okay. So.
Okay, so we have another question. In the US, patients get nitro gas. Is that also available in Mexico?
No, in this case, the medical laws right here in Mexico, the dentist right here, we cannot perform that. That's why we use the IV. It's the IV sedation is something that is better for us and also for you. You're gonna be more relaxed during all the whole procedure.
All right, we have some questions in the chat from Brian Delman. What if there are cysts? Will implants work if a patient has cysts in the bone? And is there a doctor to assist with that?
Well, we have to evaluate the problem first. Why you have the cysts and why you have everything. Yes, we have doctors that are capable to do all the work, but we have to do an evaluation first about all the cases.
Perfect. Okay. And if a patient needed a denture for an upper or lower jaw, including extractions, how long before the denture is made and put in?
Well, it takes us around two to three. We do the first, when you came in, we do all the surgical part, extraction, everything. We take impressions. Is you have, I think, 1 or 2 days. You're gonna leave with maximum 3 days because it's lab work, okay? But around 3 days, you go with the normal denture. Okay?
Perfect. We have one more question. It says, if I need implants and regular crowns, do I get the regular plans on my first visit, or do I have to wait until I return for the implant crowns?
Yes, you have to wait. Remember, this is surgical part and we have to do the healing time. So you have the implants first. Sometimes we can place, like I tell you, the temporary crowns right there. You can leave with the temporary crowns, then you have to come back and leave to the final ones, okay?
Okay. Oh, I'm sorry. I do have a personal question, Dr. Marquez. Is it, necessary to have the 2 visits, even though it's one single dental implant, or is it only with the big procedures like the all-on-4 or the zygomatic dental implants?
About 2 visits, you're asking about 1 visit for the implant and 1 visit for the crown, or?
Yes.
Yes, have to be only on 2 visits. Because like I tell you, first we have to place the implant, let the body heal by itself, let the implant get stable around the bone, and then you have to come back to do the final crown, okay?
Perfect. Guys, if you have any other questions, this is your time to go ahead and post them. Dr. Marla is also here to help us with any other questions that you might have. Remember, she is our Smile consultant. Right on our first webinar, we introduced her.
Come on, guys.
Yeah, ask her something.
Yeah.
Today
Today is your time. Go ahead. Shoot us with all the questions.
All the important questions that they ask in call center every day.
That question, that last question, it's something that the patients ask a lot. Like, it's a lot. But guys, you need to understand that the healing process is very important, right, doctor?
That's right.
Because your bone needs to heal. Is that the way it is? We cannot collocate the crown that same day. We cannot do that.
Perfect. All right. Well, it seems that those are all the questions that we had for today. So I would like to thank everyone who assisted to our webinar. This was our second webinar. So there will be a poll right here on the Zoom platform. And, once I don't know if you guys were able to answer it right now, but you will be able to answer it. And it's about what would you like it to be our next webinar topic about. Remember, it could be about any procedure. We're gonna keep on having guests, doctors, dental experts invited, so you guys can be having all your questions resolved in just one single webinar. And of course, we hope that you guys will be able to join us on our next webinars. Every time that we make one, we would like to see you guys. Do you guys have any comments? Anything you would like to say?
You first, doctor.
You first. I talk all the hour. Well, We at Sani Dental, we're very prepared to every case, and we can help you in almost all the cases. We have a very big team that is capable to do almost all the work. So you're in very good hands right here, and you are very welcome and pleased to have you right here. So any questions, I will be right here. Okay, that's all.
Dr. Marla?
Not that, I mean, that, just to guys remind you, like, yes, we have all the specialities and we have a big team of doctors, as Dr. Marquez, one of our surgeons, implantologists. And yeah, sure, that you're in a good hands. And I mean, remember that you can send your x-rays and we can, evaluate before you visit us. And I mean, we are here for help. And I'm super excited about these webinars. Thank you. Thank you, guys.
All right, so we're gonna go ahead and wrap it up. Just a little reminder to everyone that we are available right now on our phone calls. You could be able to call us or send us a message in our website. I'm sorry. We are live on chat, and not only on chat, but you can also go ahead and email. Email, chat, webinar. You can reach us anywhere, social media as well, and we will be able to gladly assist you guys. And well, I hope that you guys stay safe. Visit us very soon, and well, I see you guys on our next webinar.
Bye.